Hello, and I am looking forward to talking to you at some point later on in the future, but I figured this would definitely make things easier for you to kind of get an idea of what exactly I will be talking to you about when I give you a call. Obviously, in an ideal world, when this virus wasn't going around, I'd be at your house and we'd be able to do this a little bit more hands-on. But I think it would definitely make things a little bit easier on your end if you had this video to kind of go through exactly what the Flexitouch will be doing for you and kind of why your provider or your therapist is kind of recommending you use this. I will kind of go through exactly how we put the device on, what exactly it will be doing, and that way you can kind of go through and think of any questions you may have, and that way you have this video to kind of reference to when we talk as well. That way it's a little bit easier for you to understand exactly kind of what I'm talking about. So obviously I hope you are staying very healthy and well, but just to start, I wanted to kind of show you exactly what the device looks like. So this is what the machine will be looking like for you, okay? They have each component, there will be two components for you, okay? There is a trunk piece and also an upper extremity garment. So obviously there's a right arm or left arm depending on which side you has been affected. I will be showing you both garments and kind of how they go on and exactly what they'll be doing, what the order they'll be doing, and kind of why we feel that this will really help you out with any symptoms you kind of are have occurring at the moment. Okay, so how we would start out is this will be preset to you, by the way. So when this gets sent out to you, you will not have to worry about presetting this at all or worrying about fussing with all the buttons and all that kind of stuff. You will be able to just plug it into a wall, so you'll just have to be near an outlet. It will turn on. You just plug each hose in. So this first one will be for the trunk piece, and these three other ones will be for your upper extremity, okay? Obviously, everything I'm saying right now, what will happen is this device will get shipped out to you. Normally, when we have not a virus going around and everyone is stuck in their houses, we would have a trainer come out to your home, so you wouldn't just get a box and be like, I don't know what to do with this. You would have a trainer come out and kind of walk you through exactly what I'm kind of telling you now, as well as kind of get you fitted. Because we obviously can't do that at the moment, what we are doing is we're doing some virtual trainings. We're also doing things over the phone. Hopefully when this does all these restrictions get lifted, we will be going back to doing that. But again, we will be kind of walking you through, hand-holding you out. Any questions whatsoever you have, you call me, text me, I will be able to help you. But we will be able to kind of help you out with the fitting of everything as well. Okay, so like I had said, this is already preset to you. All you will have to do is turn it on and hit that enter button and it will start. It'll go for 1 full hour, okay, and it'll turn off automatically. So I do have a lot of patients that end up falling asleep. It is very relaxing and the pressure is very light. I have a lot of people ask, is it very noisy? Or will it turn off automatically? Anything like that, it will. And it is not noisy. Again, I have a lot of people say that they end up falling asleep, it makes them sleepy. So if you were to fall asleep, it's already gonna turn off. You just take off the garments and then go back to sleep. Another thing too, if you need to pause it to go to the bathroom, you can. It will stay paused and you can come back and put the garment back on. I would recommend just going to the bathroom before you get yourself in the garments, just because again, you are pushing fluid for about an hour. So you will notice you will maybe urinating a little more frequently. So maybe going to the bathroom right before you sit down may be the best idea. Okay, so I'm gonna kind of show you exactly what you will be doing. Okay, so this is this first piece, all right? This trunk piece, it almost looks like a little pair of shorts. And that's exactly how you'd put them on. You put them on exactly how you would put on your pants, okay? So you just step into the one leg and you step into the other leg and you pull this up. This right here has a little pocket right here to kind of help you pull that right across, okay? Again, there are these little straps too that help you kind of pull it up as well. You don't want it to be too tight. We do want to have enough room in between you in your garment, just because we want to make sure that you have room for the garment to inflate. It's not super tight. It's not going to be kind of like a compression sleeve where you're kind of struggling to get on and off. It should be very easy to kind of slide on and off. That way you have a little bit of room in between. Okay. Now this is the second piece as well. This is your upper extremity. So this is as if it were my left arm that we're being treated, okay? So you actually just slide your arm right in here. So there's this little strap that you can hold on to, and you just slide your arm right into this, okay? This piece right here, you're gonna pull across your chest, because we wanna make sure we're really getting at that chest wall as well. We wanna make sure we're really close to that, okay? This right here is almost like your little zipper to a jacket, okay? So once this is on, this is affecting both your arm and your chest, okay? As you can tell too, every one of these little chambers, these little things, as you can see, these little seams, each one of them will be inflating and deflating on its own. So you will not be all puffed up all at once. What will happen is it starts each inflate, and then the next one inflates, and then the next one. And so each one only is inflated at one time, okay? Like I had said earlier, a treatment is for 1 hour, okay? So what happens is for the first 30 minutes is considered a decongestion, okay? So what's happening is it will start down at your abdomen. It'll go up to your chest, into your bicep, into your forearm, down into your hand. And then that second 30 minutes, it's going to be going from your hand to your forearm, your bicep, your chest, and back into your abdomen. So what will be happening is we want to decongest all of those working lymph nodes before we start pushing that fluid. We want to make sure that the pathways that we're trying to push all that fluid up are nice and clear. That way, obviously, that fluid has a place to go. All right, so that's what that 30 minutes is doing first. So again, it's going to start down in your abdomen. Each section is going to be about 5 to 7 minutes, dependent on kind of the sizing of your garments as well. So what will happen to kind of what we are wanting to do is kind of mimic or do similar to what would be happening if you were at a physical therapist. It's that manual lymphatic drainage. So again, what we're doing is we're decongesting that first 30 minutes, and then that second 30 minutes is when we will be draining all that fluid out, okay? Again, that's very similar to what would be happening in the physical therapy office. I know a lot of therapists will help you out with giving you some manual lymphatic drainage that you can do on yourself. I know that can be a little bit difficult, kind of being able to, one, get to those areas and be able to do it, and two, remembering life gets the best of you. I know there's a million things going on and you forget, or you might not have the time. This kind of gives you the opportunity to just slide your stuff on, and you don't have to do any of those things on your own. Gives you a long-term option to kind of be helping yourself out with that lymphatic drainage. All right, so I want to show you as well kind of exactly what will be happening. So as you can see, like I was saying, each one inflates and deflates individually. So as you can kind of follow along there, you will see that pushing up. Okay. Another thing that I have a lot of people ask me is kind of, where do I do it? Is there a certain time of day that is better than others? Whenever you have time during the day, it does not need to be the same time every single day. Most people do it at nighttime just because of work or whatever. Busy life can be busy, obviously. But again, whatever time of day works best for you is fantastic. Where you should do it, what you would want to do is be kind of laying down. So an ideal position would probably be either laying down on your couch or laying down on your bed. A recliner position works too, and you kind of want to kind of keep this elevated a little bit. Most patients that I work with tend to say that having a little pillow underneath definitely makes it a little bit more comfortable. And And I think that would be obviously ideal, is we want to make sure you're comfortable while you're doing this as well. Again, the reason why we want to be kind of laying on that flat position is because we want to make sure that we are kind of opening up everything. So one, you're taking out gravity, so you won't have to worry about kind of going against gravity, for one. And two, when you think about like a hose, when you have water going through the hose and you bend it in half, it's harder for that fluid to kind of push up. So keeping you nice and flat just makes things a little bit easier for the fluid to be pushed out and get into those working lymph nodes. So again, as if we were using this for your left arm, we're pushing this fluid up and over and using it over to these working lymph nodes over here, as well as down in your abdomen, okay? Another question I get asked a lot too is the pressure. It is a very light pressure, though if there is any area where you are extremely sensitive, say in your chest or in your arm or in your abdomen, we are able to adjust the pressures if need be. We do not need to change the pressure of the entire device. We can do it into certain sections, which is nice. So if you were to be having some sensitivity in your chest area, what we can do is just decrease the pressure just here and work our way up as you begin to get a little bit more used to the sensitivity of that. I will also show you too kind of how you don and doff these, okay? So obviously I showed you already how to put them on. Taking them off is just as easy, okay? So you just slip your hand right in here, that little pocket, and then you're able to kind of push this off your arm like that. Again, because it's not very tight, it should be nice and easy to kind of slide off. All right, and same thing with this. It's just like you would be taking off a pair of pants. So you just kind of fold that over and slide it down just like you would be taking off your shorts. A question I always get to is what you should be wearing under it. It kind of is up to you. A lot of people do say it is easier to kind of don and doff if you do have a little bit of a lighter material on underneath. So that way if you have something super bulky on, it can make it a little bit tighter. So having something that loose fitting clothing would definitely be best. But I just wanted to kind of go through all of these things with you, just because that way, whether those questions were questions you have, or maybe those things may be kind of a spark to you to kind of think of any other questions you may have. I am extremely excited to look forward to meeting you and talking with you. And if you have any questions whatsoever, whether it be tomorrow, in a month, or in a year, I'm your go-to. So please feel free to reach out to me, and I look forward to kind of helping you feel better and working with you through this process. Thanks.